My name is Phil Kaufman. I had surgery on my shoulder, and during that surgery I had a regional block. I really thought that it managed the pain for me very well. I definitely felt safe with the procedure. It really did work wonderfully.
A nerve block is an injection of local anesthetic or numbing medication. The injection is made around a nerve and it creates numbness in a certain part of the body. There are two types of nerve blocks. A single-shot nerve block is simply injection of local anesthetic around the nerve, and that provides pain control for about 18 hours. A nerve block catheter is for patients that are having surgery that requires pain control for 2 to 3 days. We use an on-cue nerve block catheter for a variety of reasons. It's small, it's convenient, and it's very reliable.
I have had several other surgeries, and usually the anesthesia makes you extremely groggy. What I really liked about the block was that the very next day you can just wear it around your neck. I threw mine in my sling so that I could go for a walk, and I was able to be active while still having pain relief.
A nerve block is a very safe procedure. We actually use ultrasound guidance for all of our nerve block placement. This allows us to see your exact anatomy and do a very precise injection of numbing medication next to the nerve.
Patients with nerve blocks wake up almost immediately. They're alert, very happy, and pleased with how well the surgery went.
Patients that have nerve blocks tend to require less anesthesia and less narcotics. These patients have less nausea and vomiting and get back to their daily routine a lot faster. There are several types of patients that would benefit from having a nerve block. Patients with obstructive sleep apnea, patients that are morbidly obese, or patients that have a history of postoperative nausea and vomiting.
My patients receive blocks for arthroscopic surgery of the hip, the knee, the shoulder and elbow, as well as wrist surgery. I would say overwhelmingly my patients are happy they received the block. It helps significantly with pain control. In particular, I think it really facilitates the transition into the early postoperative period, which is typically the most challenging time for a patient undergoing surgery.
A block tremendously affects a patient's recovery. They're in and out of an ambulatory setting very quickly, back home with their families.
Having the block is something I definitely would recommend to a friend. It allows you to recover quicker, it allows you to return to activity quicker, and it makes a lot less pain in that process.